May I have your attention, please? We are almost there. This event is live broadcast on YouTube, the State House channel, but also the Ministry of Health channel. For that reason, then, when Her Excellency comes into this place, none of the phones with cameras will be allowed to be employed to capture images. Please comply to that directive, as that is going to create an atmosphere of tranquility as we continue with our event. Kwa mara nyingine tena napenda kuwajulisha kama mheshimiwa yu karibu kufika, lakini kuna mawili matatu ya kuelezana kabla hajawasili. Tukio hili liko mubashara kwa YouTube katika channel ya Ikulu pamoja na ya Wizara ya Afya. Kwa hiyo matukio yote tunaweza tukayapata pale. Sasa matumizi ya simu kama kamera hayataruhusiwa baada ya Mheshimiwa Rais kuwa ameingia. Naomba tusimame tumkaribishe Mheshimiwa Rais. Ladies and gentlemen, let's please rise as the President of the United Republic of Tanzania comes in. Nyimbo za taifa tafadhali. please be seated. Her Excellency.
Tanzania has made significant progress in improving public health. Our focused efforts to reduce maternal mortality have delivered remarkable results, with the rate dropping from 556 to 104 deaths per 100,000 live births. Innovations and initiatives which have strengthened healthcare by investing in the construction of comprehensive emergency and obstetric care facilities, whereby close to 70% of communities can access primary health care services within 5 kilometers. In the same period, we achieved significant reduction in under 5 mortality from 67 to 43% per 1,000 live births. Tanzania aligns with WHO recommendations to establish functional neonatal care units to reach 80% of the district hospitals having the neonatal care units. Community-centered care is at the heart of our health strategy.
Her Excellency Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania, His Excellency Dr. Jakaya Mrisho Kikwete, former President of the United Republic of Tanzania, His Excellency Dr. Philip Isdor Mpango, the Vice President of the United Republic of Tanzania, His Excellency Dr. Amani Abeid Karume, the former President of Zanzibar, Honorable Dr. Tulia Ackson, Speaker of the National Assembly, Honorable Janista Joachim Mhagama, Minister of Health, and the Honorable Ministers here present. Ambassador Dr. Moses Mpogole Kusiluka, the Chief Secretary of the United Republic of Tanzania, Engineer Zina Ahmed Said, Secretary of the Revolutionary Council and Chief Secretary of the Zanzibar Revolutionary Government, Honorable Hamza Johari, the Attorney General of the United Republic of Tanzania, Mululi Majula Mahendeka, Permanent Secretary, President's Office, State House and Permanent Secretary, and the Permanent Secretaries here present, members of the Defense and National Security Organs, Dr. Anita Zaid, President, Gender Equity Division, Gates Foundation, Dr. Pauline Basinga, Director, Africa, Gates Foundation, Saburu Washiko, Director, Deputy Director and Regional Representatives for East Africa Gates Foundation, Dr. Rasa Izad Negadar, Director, Maternal, Newborn Child Nutrition Health, Gates Foundation. Invited guests, ladies and gentlemen, thank you so much for joining us today. I'm your host, Mpoki Ulisobisia, and I'm privileged here today because we get to celebrate the remarkable progress that we have made in the health sector while looking specifically at the health of mothers and babies in Tanzania. And because of this, we are acknowledging how bright the future of our country is going to be. Because of the hard work that we have done, more women are alive to care for their newborn babies, and more babies born can grow to realize their full potential. It is such a beautiful day in which to celebrate the journey that we have taken to come to this place. To help us kick off this event, please allow me to welcome our very own Nandi, who not only has produced many hits that have conquered hearts of many over the years, she's also used her fame for the good of our people. Currently, she is Tanzania's ambassador for UNICEF's water, sanitation, and hygiene program, which helps people provided with toilets and safe and clean water. Please welcome to the stage, Nandi. Thank you so much, Nandi, for that wonderful rendition of what you do best. Ladies and gentlemen, I'd like to take a moment to briefly share with you why we are gathered in this place. Between the year 2016 and 2019, I was privileged to serve as the Permanent Secretary in the Ministry of Health. During that time, we received data on a monthly basis that was loaded with information about the state of what was happening on the ground in the country. One thing stood out very clear from the data that was coming from the National Bureau of Statistics, that the maternal mortality in Tanzania stood at 556 per 100,000 live births. Those are the women that were dying. That converted into actual nominal numbers would amount to about 20,000 women. Now, the numbers that were coming were not reflecting that to be the fact. But none of us denied the fact that there were women that were dying as they brought other lives to this world. We got to work to get to know the reason. Now, we discovered a few things. The first one was the fact that many rural places did not have adequate infrastructure for health. And so this led to women being taken long distances to seek for such services. But even when they met to those facilities, human resource for health and health commodities were not adequately provided for to intervene. And so we sought funding to improve the situation, including bringing up the infrastructure. More rural health facilities were built and were appropriately equipped to provide for the needed intervention for the women that had those problems. Her Excellency mentioned in the video that we just saw the CMOC interventions. But that was not the only one that we had in mind, or the others that would have benefited from the surgical intervention. While this was taking place, more human resource for health had to be developed, so more people got trained, while at the same time, the government that is very sensitive to the need of its population employed a few others to bridge the gap. It was a very good start, but we still had a long way to go. And when Her Excellency, President Samia Suluhu Hassan, became our leader in the year 2021, I was confident that more progress would come, because prior to her ascension to the office, I had heard, and the majority of us must have followed, she was sharing stories on what she witnessed, and those of her close relatives, if not friends, insisting on the importance of quality midwives' care to pregnant women. And she insisted it was because these midwives would be tasked with the responsibility of breaking either good news or bad news to those women that went to them for services. Thank you so much, Your Excellency, for sharing such stories and for your leadership, in which we see very clearly that maternal child health was a priority among many other things. To talk more about this progress is a group of experts who have been on the front line of this change. Please welcome to the stage our moderator, Dr. Rasa of Gates Foundation.
Thank you, Mpoki. I'm nowhere as talented as Nandi, but thanks for just using my first name. Dear all, it is a pleasure to be here today to celebrate some of the gains that Mpoki just discussed and learn more about how this came to be in Tanzania. Maternal mortality is often discussed as being an indicator of the health system itself. It is a complex process, making sure that a mother gets treated early in accordance with what her needs are, in a program that integrates nutrition, in a program that cares for her as well as for the developing baby, and all to make sure that the beginning of life goes as it's supposed to, with joy, with celebration. We've heard of the tremendous progress that has been made in Tanzania over the past several years. We understand also the path that lies ahead, the opportunity to bring additional innovations, improvements in the community, connections across the health system to continue this pace of achievement. I'm here to welcome to you 3 experts that have been on the front lines of not only generating the evidence that has been critical for the successes here in Tanzania, but also globally, who have helped understand what some of the challenges have been in terms of implementation of various aspects of this transition, whether it's comprehensive emergency obstetric care, improved referrals, improved identification of risk, or improved newborn care, or integration with nutrition. The first is Dr. Ahmad Mkwani, the Director of the Division of Reproductive, Maternal, and Child Health in Tanzania's Ministry of Health. Dr. Mkwani has been in the Ministry of Health for 13 years, where he has been involved with or led many of the programs that we will discuss and hear more about today. Dr. Sunday Domenico, who's been the Program Director of Thamini Uhai for over a decade. Thamini Uhai means value life, which is central to the work that we're all here to do. He's also the President-elect of the Association of Gynecologists and Obstetricians of Tanzania. And also Dr. Mary Sando, the CEO of the Africa Academy for Public Health, leading efforts to ensure that scientific research and our latest understanding of what is critical to making this progress is implemented in policy and practice. I welcome the panelists up to the stage. Dr. Mkwani, panelists, welcome. I'm honored and privileged to have you here. My first question is for you. We've heard about the progress that has been made. You've been central to guiding much of that process, being involved with it. Please share with us a little bit, what are the factors that you have seen as critical to making this progress?
Thank you very much for inviting me to share my experience, mitigations, coordinations, and the level we have attained. First of all, I was asked to lead the section by then of reproductive and child health to be an assistant director. And that was a way back 2018. By then, when I was joining, I was like, would I manage? That was the first question. But the first thing that I saw was we needed to have a political will. We need to have a kind of political will. And fortunately, I've been working with this area for quite some time. So the first thing was to start a campaign, which was called the Jiongeze Tuavushe Salama campaign. And I struggled with my PS, with my minister, and I remember by then the PS was Dr. Mpoke. Let us launch this thing. So we managed to get Her Excellency Dr. Samia. By then she was the Vice President, to be our guest of honor. And to be sincere, when we went to her residence to brief about this, she was saying it's a good thing. And one of the questions the challenge she put it forward, she said, we have to do it. We need to save mothers and children. And she said also that the newborns, I'm told that they are dying. So that was a start. And she signed the contract with the regional commissioners as well. And to be sincere, after the launch of Jiongeze Tuavushe Salama, our sailing as a ministry, as a sector, was easy because you could see the budget allocation for the sector, for the health sector, was going upwards. By then, I think it was standing somewhere around 1.8 trillion, and now we are talking about 2.4 trillion. And to be sincere, I would associate this rise in budget allocation because once we started Yongeza campaign, everything was like sailing up. So I would say that was a starting point. The second thing was, Mpok tried to elude on that area. The services, because the evidence says you can reduce maternal mortality and under 5 mortality only and only if people can access services, 80% of the population can access services within 5 kilometers. And to be sincere, after raising this budget, we saw everything again multiplying, the numbers are multiplying. Now we are talking 530 health centers are able to provide the cesarean section services. That means the services are now reaching there to the people in need. But the other component that we fixed was, we expect annually to have at least 360 complicated cases. For maternal, for example, 360 cases are complicated, 15% of the population of pregnant women. So those who are in the urban settings, they will enjoy the specialized care. But those who are in the grassroots level, they will end up with the general practitioners. And sometimes general practitioner says, I've offered everything, I can't offer more. So with the ministry leadership, we were able to start these groups. It was like a little play. And from those groups, WhatsApp groups, it was simply WhatsApp groups, we grew into a workable telemedicine. And one of the publications will see that in the first year when we started that service, we managed a total around 500 cases, which were critically ill women, and only 4.6% of those women died. But if we did not take this specialized care to the grassroots level by using innovation, I don't think those women can survive. And now it has grown to be a habit in all regions, whereby you see the regional leaderships making sure that all their facilities are connected within the network. Over time, with the permissive environment, political will, and here I emphasize political will, we were able to do a rigorous review. And this we started when Madam President became the full president from 2021. When we started, we said, is it possible? Let us try. We started reviewing very stringently to every maternal death and every newborn. Stringently we review through the Zoom review. And yesterday, I'm happy to say that the minister was part of the reviewers. She participated. And the other ministers who were passing through this sector as well, they participated. Through those accountability mechanisms we put in place, we saw more cases are attended adequately with specialized care. Evidence are used to transform the health sector so that it can mitigate various challenges. So in short, I would say, one is political will. Secondly, make services available close to the people. And here the coverage is 80%. And thirdly, use the little available resources to reach the underserved population. I submit it to you.
Thank you for that energetic account of what it's taken. We saw some of this actually just yesterday when we had the pleasure of discussing with you and Honorable Minister in terms of the progress that has been made, and saw the meeting live actually. Many of the from around the country, many of the different doctors calling in and honorable ministers sharing some of the approaches that we can take. It's great to see that come. Dr. Sunday, we come to you for the next question. You've been thinking about this challenge and trying to scale up particularly CMONC services. During that experience in Western Tanzania, what surprised you the most in terms of what you learned implementing those services that stood out for you?
Thank you very much, Dr. Raza, and our guest of honor, Your Excellency President of the United Republic of Tanzania, senior delegates here, and all the invited guests. I'm very honored and humbled to be on this panel. It's a momentous occasion that I think will really give us the impetus to race toward SDG 2030. Now, come back to your question. The work that you are referring here is the program to reduce maternal mortality that was implemented in Kigoma, a 13-year program that started in 2006 and all the way to 2019. It was led by the government of Tanzania, the driving seat, and supported by Bloomberg Philanthropies, H&B Agerup. And we worked very close with the Ministry of Health for technical guidance, and as well as the President Office, local government authorities, and the other key partners. Why I'm setting this stage is because this program was successful in a way that we are talking about this today, because we had a very guided enabling environment. My boss and mentor here mentioned about the political will. It was really a political will walking the talk that we really need to reduce maternal mortality. And this will was not actually just spoken. It was translated into a number of policy as well as implementation commitments. We are aware of the National Development Vision 2025, which actually is ending this year as we are developing another development vision. If you read that development vision, clearly prioritizing reproductive maternal health services, actually calling for 75% reduction of maternal mortality. And then we had the health sector strategic plans, and the subsequent guiding document was the National Plan, Accelerated Plan for Reduction of Maternal Mortality. And this was the working document. If you read that document, it clearly states that Tanzania was required to reduce maternal mortality from 578 to 193. And this was looking at a very ambitious target by 2015. So the interventions which have been articulated in that document include scaling up comprehensive emergency obstetric care services. And it required that by 2015, you would have covered 50% of the health centers to have CMOC, 80% of hospitals to provide the CMOC, and 70% of the dispensaries to be able to offer the required services. Now, beyond this, the policy environment that I've described, what really made this program successful, the idea was conceived from the local community, from the local doctors. And allow me to mention the late Dr. Mbaruku, God may continue to rest in peace. He conceived this idea that if you look at the geography of Kigoma, for those who have been to Kigoma, you look at the Lake Tanganyika shores and everything. There are communities that are to negotiate 18 hours along the lake shore to be able to reach to Maweni for comprehensive emergency obstetric and newborn care. Imagine you have a postpartum hemorrhage, a woman bleeding, you have a ruptured uterus, you have obstructed labor. It is impossible. Certainly this will be another registered death. So from the initiative by Dr. Mbaruku, and with this policy environment very supportive, the program was able to work with the local government, guided by the Ministry of Health, to scale up comprehensive emergency obstetric care, reaching over 16 health facilities. And the dream was really to have the facilities with a minimum of two hours from the neighboring community to be able to reach this care. And this was made possible over the course of implementation. By the time the program was coming to an end in 2019, we had about 61% of the communities could actually deliver in facilities we were providing CMOC services. But also, as a result of this, we had facility deliveries going all the way to 80%, which was almost double from the time the program started. As a result, maternal mortality declined by 43%. We had also neonatal mortality declining. And the reason we are connecting this program essentially gave us a lesson that it's really feasible to bring care from high-level hospitals to the health centers. And the ministry was there to listen. We had a lot of forums, including the Big Disaster Now Lab, for those who remember 10 years ago. I was very lucky to be invited here, and we had a lot of critical discussion with the experts, including Dr. Makwani and others. Thus, let's explore this. Let's make this work in the context of Tanzania. And the rest is story that we are hearing here. Beyond that, we had a very good, robust monitoring evaluation. Data, the power of data. You know, if you're implementing a very good intervention, a very good program, if you do not measure the progress that you are making, it is almost useless because you don't know where you're making the right direction. So here we had the U.S. Center for Disease Control and Prevention, which was leading the evaluation. And being a technical lead in that, I was always in my toes. I know CDC, at the end of the year, they come back and ask me why facilities are not offering CMOX. So always you work with the data, work with the local facility, local experts, trying to advance this work to further heights. And finally, if a key lesson that I would advocate further, this program was so much guided by evidence. We can have very good interventions, but if you're just trying, testing every time, it was guided by evidence. We all know that majority of maternal mortality would come from the big five that are contributing about 70%. And to be able to take care of them, you need availability of quality. Key quality is very important. Quality emergency obstetric and newborn care. So we had a very robust quality improvement initiative, including clinical audits over the complications, maternal death, and everything that essentially help us to work with the healthcare providers in the facility to refine the work that we do, to ensure that when women come to the facilities, they really receive the quality of care that is needed. On the same thinking, we understand that postpartum hemorrhage is the leading cause of maternal mortality, not only in Tanzania, even globally. In Tanzania, we count about 33% of all the maternal deaths from PPH. So here, we had a very commendable global evidence coming out. The woman trial, which actually advocated for use of antifibrinolytic for the prevention of and the management of postpartum hemorrhage. So the program worked with the government at that moment it was not in the national guidelines, but we made a decision that if WHO is recommending this very strongly, the evidence is there, then we scaled up the use of TX in the facilities, and then that initiative came to the level of the ministry. It was captured in all the relevant guidelines, and the rest is the story again. So, Raz, I'd be able to explain a lot more, but I think time is very limited. The key message here is you have to have the right enabling environment, have the clear concepts developing from the grassroots, have the right people take it forward, and most importantly, please ensure you are scaling up evidence-based recommendations. Thank you very much.
Thank you, Sunday. As a student of learning more about the maternal and newborn health field from the Gates Foundation, really understanding what has led to that implementation, prioritizing local needs and grassroots is critical, and it comes through in your story. Mary, the evidence point was underscored by Sunday. You've been at the forefront of generating much of that. In fact, Tanzania as a country has been the site for many of the most transformative studies in this field, whether it's on multiple micronutrient supplements, on low-dose calcium, on the MOTIVE trial or tranexamic acid. I'd love if you could share a little bit of your experience of how do we take the best of that evidence that is being generated and implement it into policy? What are the challenges? How do we overcome those?
Thank you very much, Rasa. So in terms of looking at evidence, I would start by saying context is crucial in shaping health priorities and policies in any country. But of course, locally generated evidence is essential in forming those policies and priorities. For instance, when you look at epidemiologically, not only do health challenges in Tanzania differ from those in other parts of the world, but also the feasibility and adoption of solutions also vary globally. Citing an example, we all know that the World Health Organization recommends calcium supplementation during pregnancy. However, high costs dosing complexities, and logistical challenges have hindered adoption of such life-saving interventions in many countries, including here in Tanzania. But fortunately, as you have noted, Raza, we have evidence from Tanzania that has been done by Tanzanian institutions, including the Africa Academy for Public Health, Ifakara Health Institute, and our Muhimbili University of Health and Allied Sciences, in collaboration with Harvard University. Scientists demonstrated that the provision of a single low dose of 500 milligram calcium daily is superior and is as effective as the recommended 3 doses in the current WHO guidelines in prevention of preeclampsia and preterm birth. This evidence, homegrown here in Tanzania, is currently being used to help see how we can bring this intervention to pregnant women in Tanzania. We hope that we can pave a way and many countries can also follow. But looking back again, in over 40 years, the standard care for antenatal services has been provision of iron and folic acid to pregnant women. But again, evidence, including research studies done here in Tanzania by our own researchers, has also demonstrated that the provision of multiple micronutrient supplementation, which includes iron and folic acid, together with 13 other essential micronutrients, is superior to provision of iron and folic acid alone in preventing stillbirth, preterm birth, and low birth weight, which are really predisposing reasons for neonatal mortality. And therefore, again, this speaks about the importance of ensuring that our own evidence can really be used to advance and improve our guidelines. If I speak of mainly 2 issues here, is challenges on implementation of existing guidelines, such as the ones that we have contributed to building the evidence, and the WHO has given this recommendation. The second point I would like to touch upon is on the importance of testing different innovations. It is important that we are able to be part of testing these interventions and ensuring that in the process we have the confidence with the data to be able to say, why not as a country, confidently that we've been able to advance these efforts for scaling up for a much more impactful improvement, especially of the SDGs, maternal, neonatal, and child mortality. Thank you.
Thank you, Mary. We're going to go to just one final question for each of you on the panel to keep us on time. One of the path ahead is between now and really trying to reach the 2030 goals. What advice do you have to all of us gathered in the room, policymakers, implementers, organizations? What is it that we should be doing differently between now and 2030 in order to accelerate, continue to make this progress, and reach the goals? Your advice on what we should do differently. Dr. Mukwani, I'll start from you, and then from each of you, please.
Thank you very much, Raza. And one of the things that I would say as a way moving forward, concentrating resources. In this world whereby we have government resources and partner resources, we have seen that sometimes we have some challenges in terms of making sure that all the resources really target the last person in the rural area. And we have seen some of the projects whereby they've changed from giving partners, instead the government becomes a center of implementation. The value for money, you can account it very, very easier. And I speak this with the passion, saying that if all the resources were real targeting this Tanzanian, we would have attained most of the goals early enough before 2030. For example, now we are struggling with the neonatal care. There's no doubt that the under 5 mortality rate that we see very, very high, 2/3 is being contributed by the under 5, by the neonatal mortality. And if we are able to break that ceiling, that means the under 5 mortality, it will be like a crashing ceiling down. And that is only possible if we are able to make sure that, again, every district hospital has a neonatal care unit. That neonatal care unit has required equipment, and the life-saving equipment here, we are talking of CPAPs, we are talking of phototherapies, we have the right medicines, and the medicines, the caffeine we grow. All these things can be available only and only if we have a concerted approach whereby we are saying we want to target this intervention together and we will work it together under the full 100% leadership of the government. Whether it goes to the partner, but the partner, whatever does, the government must say, you have to do this. We have to account the resources we put on it. That is my biggest advice I wish. Because we have seen, we have learned with a few resources which have been directed to the government, the value for money, you see it abruptly. You see it, you get it. That's number one. Number two, we need to work with the government, again, to ensure that it is adequate human resource. To be sincere, we are happy the little human resource we have managed to attain these results. But there are people who spend many, many hours, overtimes, to make sure we get these results. And they are doing that simply because there is inadequate human resource. Again, if the resources were concentrated and we sit with the government and say, here you have a challenge of human resource, please, we want to support you with this amount of funds. Try to fill the gaps. These gaps could have been filled very, very easily. So for me, I can see the light at the end of the tunnel. 2030, we are likely to get in maternal mortality. But for these other interventions like neonatal care, issues like nutrition, we need a concerted approaches whereby the resources, all the resources which come in country are tracked and we make sure they get to the right people. I submit to you.
Yeah, that's critical. Thank you so much for that. Thank you. Yeah, I think that's critical. Sunday.
Thank you very much. I started first by agreeing with Dr. Makwan that we need the resources that are real streamlined. And the question of human resource is critical that we really address it. Now, beyond those points, having worked under Dr. Makwan for the previous 4 years and working on MPDCR, I've learned that essentially we need to zoom in on the quality of care that we are offering to the women who are coming to our facilities. And when I talk about quality of care, it's a very big blanket, but I would like to zoom in and say that essentially among the key issues that you have to address is the competence of healthcare providers who are managing complications. Of course, the current workforce that we have, they are really doing a good job. Indeed, we have to optimize their capacity by continuing to do more. And here, allow me to mention we have a mentorship program, which is very much named the Mama Samia Mentorship Program, Dr. Samia Mentorship Program, which really we have been working with the professional experts from professional associations to build the capacity of healthcare providers in their facilities on site so that they continue to offer care while also learning the new skills. I think these are the kind of innovation and intervention that we should always continue to push and do more so that all the healthcare providers in the facilities know exactly what to do when they encounter a mother or a newborn with complications and be able to take the necessary actions, and if possible, if not within their capacity, they should be able to refer promptly and beyond. And another thing that I think is very important, when it comes to support from partners or donors, one thing that we really need to look forward is we should look at our health system in a very comprehensive way. For example, you may have a program that supports, say, scaling up of emotive bundle, very good innovation. But however, beyond the PPH, you have other issues which are around. Providers may be having no skills to perform cesarean section, no skills to manage. So when we design programs, that's when the role of the government comes in. They should be very comprehensive in a way that you go to a facility, you are able to address all the key bottlenecks in the health systems. And that's where the WHO health system model comes in play, that you design a program which it could be one donor supporting this intervention, or supporting this part, so that together we address the whole health system and then be able to take care of the challenges that are needed to be addressed. And finally, professional societies. I think Rais expected me to mention about this. Being a president-elect for Association for OBGYN, when it comes to the professional work that is done everywhere, we should always leverage on the professional societies because of the greater network they have, down the grassroots up to the facilities level, but also the expertise the professional society bring on boards. These together, when they work with the government and other key players, we are really going to maximize the action that we do on the ground. And you can make the thing happen finally. Final point, newborn care. You know, whenever we talk about this, the milestone that we have covered, we know we have a journey to go. 25 neonatal death per 1,000 live birth, which translates to over 50,000 neonatal deaths per year. That number needs to come down. It's not by talking. We have to invest on scaling up facility that can offer comprehensive newborn care services, level 2 facilities, which can ensure that babies who are coming with several complications can be treated at nearest facility as much as we are doing for CMOC. Thank you, Raz.
Thank you. Those are great lessons and really important to facilitate groups coming together to make sure it's comprehensive. I agree. This is not a simple task to just divide and go one after the other. Mary, please, last word with you.
Thank you very much again, Raza. So I spoke earlier about challenges in implementation of already existing interventions. Maybe I would like to touch a little bit about innovation, the importance of testing new innovations. And here we understand that maternal and child undernutrition are really precursors of poor prognosis, health prognosis overall. A mother is undernourished and she's carrying a baby. One can imagine the baby may be born too early, may be born underweight and all that. And therefore, this really brings us to a call. We understand what happens. We have seen progress. We have all the evidence globally on what other countries have done to advance improvements and improve health outcomes. Among reasons why we are here today, improving SDGs, particularly for women, neonates, and children. And therefore, we need to be ready to also be innovative. For instance, right now, we have women being seen at antenatal clinics. How can we best innovate on the way that we can be able to much better monitor their HB? And how can we integrate, for instance, nutrition supplementation programs? Or else, how can we better manage severe forms of anemia? Can we find ways in which that we can provide IV iron, for instance? So all these experts know what works. But how can we best innovate within our constrained health systems so that we can much better do a better job? But just to speak a little bit more, we actually have to enhance nutrition for women and children. But how do we work multi-sectorally so that truly integration, we know nutrition is a cross-cutting issue, that every sector that can contribute really can be able to do so. And lastly, looking at life-saving interventions such as the multiple micronutrient supplementation. Can we look at regional development, regional production of nutritional commodities such as MMS, but also looking at innovations in data systems so that as we monitor, if we're to roll multiple micronutrient supplementation or also implement calcium in our guidelines, how can we ensure that our data systems, while we are monitoring the integration of these new interventions, is also able to give us the ripple effects of understanding how we're making progress going forward? Maybe I stop there and thank you very much.
Thank you so much to my panelists for your time today. You have distilled the immense experience that each of you has brought in the work that you have done and guided us in terms of what is needed to try to continue this so that we can achieve the goals. I'm thankful for that. Our partners, thank you for having us here, and we look forward to the rest. Dr. Mpoki, over to you.
Great work, Dr. Rasa Izanegadar. I got it?
You got it.
Wasn't the conversation insightful and fascinating? That's what it takes when you start walking the talk in the health sector. Tanzania has been working to improve the health and lives of mothers and children for many years. Yesterday, somebody whispered to me of Her Excellency's experience with Kidonge Chekundu. Remember that? Your Excellency, that is what today we call as FIFOL, or iron and folic acid. Now, the panelists are telling us that is not enough, and so we need to go for the much lauded. Progress is not always linear. You heard from the panelists. It does tend to build itself over time. Time is of the essence. Your Excellency, I beg for your indulgence. My brother Albert Chalamila was not called out when I was introducing the dignitaries in attendance. Please, that is mine. But feel welcome, as others were made to feel welcome. All right, we are gathered here today to award the Global Goalkeeper Award to one of the most steadfast leaders behind the momentum we have in Tanzania. Thank you. Now, we go back to the Global Award. The Global Goalkeeper Award is given in recognition of individuals who have pushed their countries closer to reaching the global goals by 2030. These are individuals whose determination and vision do get hard things done. I need to underline that. Bold underline. They have the ability, the vision to get hard things done and inspire all of us. Your Excellency, cutting down on maternal mortality from 556 to less than 150 is a good achievement, except one life lost is one too many. If only we had in this country 0. So here to talk about this achievement and the way to achieving this dream is none other than the President of Gender Equality at Gates Foundation Division, Dr. Anita Zaid. Please welcome.
Karibunu Sana, Assalamu alaikum, and welcome everyone. Thank you so much for being here today. I am so delighted to be here to celebrate this honor for Tanzania and for Your Excellency, Madam President Samia Hassan, for the impressive progress that has been made in Tanzania that you heard about this afternoon. In 2015, when many countries, along with Tanzania, signed up for the Sustainable Development Goals, Tanzania also committed to the health and well-being of all its citizens. And it's one of the countries that is actually on track to achieve those goals. And you can see the fruits of that promise in the fact that more women in this country now live to be mothers to their children. that more children grow up to celebrate their 5th birthday, and that young people have real optimism that they will live the lives that they dream of. I am the president of gender equality at the Gates Foundation, but I started my career as a pediatrician, and I'm from Pakistan. And I can't tell you how many young women I saw who died during childbirth, and too many babies that did not live to see their first month or to see their first birthday. In short, I saw the consequences of ignoring maternal health, of ignoring child health, and of ignoring one of the biggest drivers of maternal and child deaths, which is malnutrition. In 2021, President Samia Suluhu Hassan became the first female president of Tanzania, and she has shown that she understands those consequences too. Under her leadership, the government hasn't just continued the country's work in maternal and child health, it has decided to do even more. The government built many new facilities with a comprehensive obstetric care, and they expanded the services that they provided so that women could be served. They embraced the use of maternal health data, really crucial, to deliver the right solutions to the women who need them. And they extended the fantastic program M-Mama, the transportation program, so that new and expected mothers could get to a health facility if they suffered from an obstetric emergency. These are just a few of the efforts that ensure more women receive antenatal care early and throughout their pregnancy. And when it comes time to deliver, that they have access to a facility that is appropriately staffed with skilled staff who can deliver the care that is needed to bring a new baby into this world. What does that mean in human terms? Well, child deaths have fallen 1/3 in Tanzania since 2015. But even more impressive, maternal mortality has dropped by 80%. Yes, that's right. Maternal deaths in Tanzania have come down by 80% since 2015. This is a remarkable achievement. The story is similar across so many areas of health and development in Tanzania. Tanzania has championed the importance of breastfeeding, which puts the country on track to achieve among the highest rates. Tanzania is also fighting neural tube defects, which is a problem that happens due to the deficiency of folic acid in the diet, and it's partnering with private sector to fortify staple foods with essential nutrients, such as folic acid. And to stimulate economic growth and resilience, the country has opened an agricultural transformation office and launched a national financial inclusion strategy, spurring inclusive economic growth and resilience to move the country closer to achieving its 2050 vision goals. This work takes leadership, it takes collaboration, and it takes an unwavering focus. It takes the dedication. It takes the dedication of so many of you in the audience today to stay the course. And there are so many competing needs and priorities, prioritizing mothers' and babies' health. Tanzania has shown that it can be done, that when a country comes together, amazing progress is possible. Before presenting the award, I would like to welcome the Honorable Jenista Magama, the Minister of Health for Tanzania, to the stage for a few remarks about this remarkable achievement. Honorable Minister.
Your Excellency, Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania, Honorable Dr. Philip Isdori Mpango, the Vice President of the United Republic of Tanzania, Honorable Jakaya Mrisho Kikwete, the former President of the United Republic of Tanzania, Honorable Amani Abedi Karume, the former President of the Revolutionary Government of Zanzibar, Honorable Dr. Tulia Ackson, the Speaker of the National Assembly, ministers who are present here today, Dr. Anita Zaidi, the President of Gates Foundation, Health Equity and Gender Division, Balozi Kusiluka, the Chief Secretary, United Republic of Tanzania, Engineer Zena Saidi, the Chief Secretary, Zanzibar, Regional Commissioner, Dar es Salaam, representatives of Gates Foundation, all government officials, distinguished guests, ladies and gentlemen. Na wasalimu kwa jina la Jamhuri ya Muungano wa Tanzania. Tuzo yetu ya kimataifa hoye. Asanteni sana. Your Excellency President, it is with great honor and pride that I stand before you today on this momentous occasion. We gather here to celebrate not only an award, but remarkable recognition of your visionary leadership and dedication to the well-being of our Tanzanians. Your Excellency President, today the Gates Foundation has bestowed upon you this prestigious Goalkeepers Award as a testament to the tireless efforts and unwavering commitment to advancing healthcare, promoting Tanzanian developments, and ensuring healthier and more prosperous Tanzania for all. Your Excellency President, under your leadership, Tanzania has made commendable job in strengthening our healthcare system, expanding access to quality medical services, and implementing innovative solutions to address pressing health challenges. This award reflects the tangible impact of policies that prioritize maternal and child health, universal health access, and the fight against non-communicable diseases and communicable diseases. Your Excellency President, your dedication to the health sector has inspired significant progress. Your Excellency, allow me to take this rare opportunity to mention just a few among many others. Your Excellency, our government have managed to increase investment in healthcare infrastructures by increasing the number of health facilities from 8,458 in the year 2020 to the number of 9,826 in the year of 2024. Apart from that, we have also managed to increase the number of hospitals with emergency medicine department from 7 hospitals in the year 2020 to 113 in the year of 2024. Your Excellency President, our government increased the number of health facilities providing comprehensive maternal and neonatal care from 340 in 2020 to 523 in the year 2024. Your Excellency President, availability of essential health commodities increased massively from 73% in 2020 to 86% in 2024. Your Excellency, Madam President, our government have managed to strengthen the diagnostic services for the past 4 years by installing 9 MRIs, which are very new, 33 CT scans, 400 81 digital X-ray machines, and 625 ultrasound machines. We have strengthening partnership with the global health organizations and the other development partners. And currently, Your Excellency President, we have introduced the new law on universal health insurance as our country commitment to achieving universal health coverage for all Tanzanians. Your Excellency President, this award also acknowledges the determination of our health care professionals, our doctors, nurses, community health workers, and our researchers who work tirelessly to improve the lives of across the whole country. Your Excellency President, to the Gates Foundation, I would like to extend my deepest gratitude for recognizing Tanzanians' journey towards sustainable development goals. Your continual support and collaboration play a crucial role in shaping future where no one is going to be left behind. As we celebrate this achievement, let us together reaffirm our collective commitment to advancing health equity, solving global challenges, and building a nation where every Tanzanian citizen has access to the quality health care we deserve. Your Excellency President, let me take this opportunity once again to thank you for accepting this award today. And I would like humbly to take this opportunity to welcome the Vice President to give the remarks and to welcome you to speak in this gathering today. Mungu ibariki Tanzania, Mungu mbariki Rais wetu. Ni heshima kubwa sana kwetu. Kwa mara ya kwanza, Gates Foundation wanatoa award hii nje ya taifa la Marekani. Ni heshima kwa nchi yetu ya Tanzania. Lakini pia, kwa mara ya kwanza, Mheshimiwa Rais wa Jamhuri ya Muungano wa Tanzania anaweka historia ya pekee kuwa rais wa kwanza katika bara la Afrika kupata tuzo hii ya kimataifa. Lakini vile vile ni rais wa kwanza kwenye bara la Afrika. Nilikuwa naendelea kufanya research kuona kama ni kwenye ulimwengu mzima anapata award hii kwenye siku muhimu kama hii ya leo. Kwa hiyo tumshukuru sana Mwenyezi Mungu kwa kuwa na rais wa namna hii, kwa kuwa na mafanikio makubwa, na niwaombe wanawake wa Tanzania, tuzo ya leo inahusu uhai wetu wakati wa kujifungua, na sisi wanawake ndio tunaobeba jukumu hili kubwa. Kwa hiyo leo ni siku yetu, leo ni siku ya kumpongeza, leo ni siku ya kumshukuru sana Mheshimiwa Rais wa Jamhuri ya Muungano wa Tanzania kwa kuokoa maisha ya wanawake wa Tanzania. Tuna kila sababu ya kutembea kifua mbele, tuna kila sababu ya kumshukuru Mwenyezi Mungu kwa ajili ya maisha ya rais wetu Dr. Samia Suluhu Hassan. Mwenyezi Mungu aendelee kulibariki taifa letu, amlinde rais wetu, tuendelee kufanikiwa zaidi, tuendelee kupata heshima zaidi za kimataifa. Na hii sio tuzo ya kwanza, ni kati ya tuzo nyingine nyingi, lakini hii ina upekee kwa ustawi wa maisha ya wanawake wa Tanzania na watoto wa Tanzania. Mheshimiwa Makamu wa Rais, karibu sana.
Mheshimiwa Dr. Samia Suluhu Hassan, Rais wa Jamhuri ya Muungano wa Tanzania, waheshimiwa viongozi wakuu wastaafu, waheshimiwa viongozi wote mlioko humu ndani, itifaki imezingatiwa. Habari za mchana. Mheshimiwa Rais, kama walivyokwisha kusema walionitangulia, tumekutanika hapa kusherehekea moja kati ya mafanikio mengi na kwa namna ya pekee kutambua uongozi wako wenye maono ambao umejikita katika kuboresha huduma za afya na ustawi wa watu. Na tuzo hii ya Goalkeepers ambayo inatolewa kwako, licha ya kutambua mchango wako, pia inatoa hamasa kwetu sisi sote kuzidisha jitihada katika kuboresha maisha ya Watanzania. Hongera sana kwa kupokea tuzo hii. Mheshimiwa Rais, tunakushukuru kwa dhati. Tunawashukuru kwa dhati wakfu wa Gates kwa kukutunukia tuzo hii ya heshima ambayo ni uthibitisho wa jitihada zako katika kuinua utoaji wa afya, kukuza maendeleo na kujenga Tanzania yenye neema kwa wote. Hakika tuzo hii imetambua safari ya nchi yetu kuelekea katika kufikia malengo ya maendeleo endelevu ya Umoja wa Mataifa. Na tunaposherehekea mafanikio haya, tunamuomba Mwenyezi Mungu akupe umri mrefu ili pamoja na mambo mengine uweze kuendelea kuinua usawa katika utoaji wa huduma za afya, kuendeleza jitihada za kimataifa za kupambana na changamoto mbalimbali na kuendelea kutembea kifua mbele katika kujenga taifa ambalo kila mwananchi anapata huduma bora zaidi za afya. Mheshimiwa Rais, bila kupoteza muda, ninayo heshima kukukaribisha uzungumze na hadhara hii. Mheshimiwa Rais, karibu.
Mheshimiwa, tukae. First. Okay. Tukae. Waheshimiwa, kwa sababu hakuna translation, tazungumza lugha ambayo wenzetu wanatuelewa. Vinginevyo ningetakiwa kuzungumza Kiswahili, lakini tutatafsiri baadaye. So Excellencies, former President Dr. Jakaya Mrisho Kikwete, former President of the United Republic of Tanzania, and Dr. Amani Karume, the former President of the Government of Zanzibar, Revolutionary Government of Zanzibar. Your Excellency Dr. Philip Isdori Mpango, the Vice President of the United Republic of Tanzania, Your Excellency the Speaker of the Parliament, the United Republic of Tanzania, Madam Tulia Ackson, Your Excellency Jenista Mhagama, Minister for Health, Tanzania, Chief Secretaries of the United Republic of Tanzania, Dr. Kusiluka, and Engineer Zena for Zanzibar, Permanent Secretaries here present, Dar es Salaam Regional Commissioner, Honorable Albert Chalamila, Dr. Anita Zaidi, President of the Gender Equality Division at the Gates Foundation, Dr. Rasa, Director Maternal, Newborn, Child Nutrition and Health at Gates Foundation, and the delegation from the Gates Foundation, heads of security organs here with us, distinguished guests, members of the press, ladies and gentlemen, good afternoon. Dr. Anita and the delegation, I wish to welcome you to Tanzania and thank you for coming all this way to engage with us. We are honored to have you here, and we salute your commitment to championing global health. Thank you very much. I'm honored to stand here before this gathering to accept this prestigious Global Goalkeepers Award. This award is not only encouraging but also inspiring for many reasons. Foremost, the Gates Foundation, in addition to being an important player in the global health agenda, has continued to be a valuable partner to Tanzania. Secondly, this award is a recognition of the collective leadership and commitment by Tanzanian people who work tirelessly to improve the lives and livelihoods of women, children, and families in Tanzania. So we thank you very much. Ladies and gentlemen, reducing maternal, newborn, child, and adolescent mortality and improving nutrition has been at the core of our national development agenda. As a head of state who also happens to be a mother, investment in maternal health is something that is very dear to me. This is why, upon assuming this high office, I pledge that in addition to investing in health facilities and staff, we would prioritize maternal and child health. Since 2021, we have undertaken various measures to improve reproductive, maternal, newborn, child, and adolescent health, as well as nutrition. It is encouraging to note that due to various strategic interventions, maternal mortality ratio has declined, as it has been said here, but also under 5 mortality has declined as well from 67 to 43% per 1,000, 63 to 43 per 1,000 births. And in our quest to improve reproductive, maternal, newborn, child, and adolescent health, as well as nutrition, together with what has been, together with the measures that has been explained by the panelists and probably the minister, allow me to add my voice on what has been done and what should we do to put the health agenda at the top of our national policy. Firstly, we have increased the number of registered medical specialists, obstetrics and gynecologists from 69 in 2020 to 338 in 2024. Secondly, we have been offering free maternal and under 5 health services. We have also strengthened the referral systems by producing 727 ambulances in 9 years from 2015 to 2024, thereby enhancing access to emergency obstetric care by bridging the gap between rural communities and health facilities, and ensuring timely intervention of the life-threatening cases. To complement the referral system, we have introduced the mMama emergency obstetric and newborn care referral services. Furthermore, we have, and this is done, was done or is done together with the Vodacom Foundation. Furthermore, we have increased the number of ultrasound oral sonographic machines from 345 in 2020 to 970 in 2024. But for the hard-to-reach areas, the government has taken massive construction of the rural roads to ease in the trips to and from the health centers. Fourthly, we have leveraged on advancement of ICT to conduct countrywide maternal and perinatal death reviews virtually, and the result of which is the realization that competence in managing our efforts to intensify capacity building through mentorship to the healthcare providers. Fifth, the rolled out multi-sectoral strategies, including the use of technology in nutrition assessment by procuring cobas machines. These machines have strengthened the capacity of our national laboratory to conduct a nutrition-related analysis, such as the use of biological samples to assess nutritional status. By using local expertise, we designed a modern local salt mixing machine that ensured adequate iodine levels. Collectively, these various interventions have increased the rate of wasting among children under the age of 5 from 4.5% in 2015 to 3% in 2022. Stunting among children under 5 has declined from 42 in 2015 to 30%, and underweight has decreased from 16% to 12% over the same period. Here, we haven't done much good, but then it's a progress, and the journey continues. We are continuing to take required measures to continue reducing the underweight, the stunting, and the malnutrition. Fifth, we have been implementing a national accelerated action on investment agenda for adolescent health and well-being, focused on addressing teenage pregnancies and gender equality, empowering girls with education and life skills. These efforts provided tools needed for girls to make the right and informed choices and lead healthier lives. As a result, teenage pregnancy has decreased from 27% to 22%. Sixth, deployment of community health workers who have been instrumental by providing access to essential healthcare services at the grassroots level. The community health workers have served as a vital link between health facilities and communities, delivering critical health education and promoting immunization and nutrition programs. They also have contributed to the increase of awareness and addressing barriers such as traditional or cultural practices. Their role in preventive care, coupled with early detection and referrals, has not only reduced preventable deaths, but also strengthened community trust in health care system. Ladies and gentlemen, this progress has not been achieved in isolation. It is the result of collective actions. The unwavering dedication of our health workers, the partnership of civil society organizations like the Jakaya Kikwete Foundation and others, and the support of global allies like the Gates Foundation and others. However, much as we celebrate these achievements, we recognize that the journey is far from over. We still have work to do to further improve these metrics and improve health services. Additionally, other challenges such as climate change, regional outbreaks, and economic inequality remind us that our work must continue with renewed vigor. You may wish to note that this year we are finalizing implementation of our national development vision that covered the 25 years period from the year 2025 up to this, from the year 2000 up to this year 2025. And in it, we had set to increase health and well-being of Tanzanians and to raise the life expectancy. I'm happy to note that since then, life expectancy rose from 51.5 years to 66 years in 2022. Over the next 25 years, we aim to further invest in health and increasing accessibility so as to raise the life expectancy at least up to 75 years. In this regard, we call for continued engagement with the Gates Foundation as we work to meet our health goals for our people. Ladies and gentlemen, it is my ambition to realize continued investment in specialized health facilities and services. One area where we see continued partnership is training and capacity building to ensure we address the shortage of qualified staff and specialized manpower. Tanzania's story is a testament to what is possible when we place health, nutrition, and equality at the forefront of our priorities. As a global community, we share responsibility to ensure that no woman, child, or adolescent is left behind. To my fellow leaders and policymakers in this room today, let this award inspire us to push the boundaries of what is achievable. Let us commit in investing in systems that uphold the dignity of every individual, ensuring that progress is sustainable and inclusive. Ladies and gentlemen, as I conclude my remarks, let me dedicate this award to all health workers whose compassion Thank you. To all health workers whose compassion, skills, and resilience made our efforts meaningful. Together, we continue to champion the global goals and ensuring that health remain a universal right. Thank you very much for your kind attention.
Thank you very much, Your Excellency. Can I please ask for your indulgence? Tafadhali tukai, please be seated. Sorry. The audience never got to see the presentation of the award as they would have wanted, so we pray that Dr. Anita to come up, Honorable Janista Mhagama, the Minister for Health, President Abedaman Karume, please come. Yes. Dr. Mpango and President Kikwete. Please come to the stage. Madam Speaker, please. Thank you so much. You may go back to your seats. Okay. I am reminded that the two of you need to remain standing. Your Excellency, the two of you need to remain standing on a request, yes. With the award. Okay, all right, that's good. So. Thank you so much. Now it's time for the fire chat.
Madam President, thank you so much for accepting this award, and it's such an honor to be on the stage with you and celebrate this moment of joy for you and for your team and for all of Tanzania. I thought we would just have a brief conversation about your personal commitment to maternal and child health. How did that come about, and under your leadership, why have you chosen this to be such a big cause for you?
Thank you, Anita, for that question. You know, as a woman and a mother, I've gone through what other women are going through, giving birth to boys and girls. And I've seen what is happening in our labor wards, and I've seen how women die during that noble cause of giving lives to the world. So I decided and dedicated myself to heavily invest in health sector, with intention or with emphasis on health of mothers and children. So that's how it comes about, yeah.
Wonderful. And although such remarkable progress has been made in maternal health, we heard also from you yourself that you would like to see more progress on newborns, because that has been a persistent challenge, with about 3% newborns dying in their first month of life. So how do you plan to tackle this challenge over the next, until the SDG 2030 goal timeline?
Okay. Yeah, I've gone through the scientific researches on health, and they are suggesting that most of the newborn and maternal deaths is due to due to malnutrition. And this is an area which we as Tanzania has to keep close eye on. And we have started taking various actions, like fortification, iodization, providing folic acids in clinics, but also I've entered into contract with the regional commissioners to make sure they are reducing the rate of malnutrition in their areas. And that has helped, because that is one of the KPIs for them. So they are working well, and as you can see, the rate is decreasing, not in a very good pace, but we are in the process. It's going to increase. And that's one of my priority areas. So.
Wonderful. Thank you so much. Thank you so much, Madam President, for sharing your knowledge and your insights and your passion with our audience today, and your commitment to keep working on this cause. We really appreciate it. Thank you so much.
Thank you, Anita, and we appreciate and we are very grateful with Gates Foundation's support, unwavering support, rather, to Tanzania. Thank you very much.
Please be seated. This has been a fantastic fire chat, wasn't it? From talking from the heart. Sadly, this brings us to the end of the program. Thank you to Her Excellence President Dr. Samia Suluhu Hassan and the panelists, and for joining us to celebrate Tanzania's progress in maternal and child health. I was privileged to visit a rural village in Mbarali district, Mbeya region, a few years ago. The reason for the visit was their track record that they had not experienced a maternal death for 18 years. So I wanted to learn what different thing were they doing to have such a wonderful track record. And I realized that one of the most important factors was the robust network of community health workers in the region. The village had so many of them, they called themselves Commandos for Health. These had the responsibility of tracking on the health-seeking behavior of the expectant mothers during the course of their pregnancy up to delivery, and the babies that were born up to the age of 5. This taught me a lesson that it truly does take everyone to experience the results such as we are noting in this country, from the most senior government leaders, but to every person in our society, that is including you, including me, wherever we are staying. This generated a position of perspection, a perspective of hope that one day, Your Excellency, in this country, mothers would enjoy safe birth and their children will start life on a right footing. We still have a lot of work to do over truth, but it has been wonderful to take a moment to celebrate the journey that we have traveled on to this point. And we will keep going on, rest assured. And so allow me to thank everyone for coming. And before we join the reception, we need to invite Nandi one more time. Nandi?
Unanipenda mpaka
Thank you so much. Thank you so much, Nandi, for that piece. Ladies and gentlemen, we've come to the end. I want to believe that this is just a pause in the long journey towards improved maternal-child health in this country. Your Excellency, thank you so much for gracing this occasion. And ladies and gentlemen, shall we stand as each one of us takes their leave, and we shall be guided as we exit on our next destination this afternoon. Thank you so much. God bless each one of you.